Assalamualaikum. I'm Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine and Toxicology. Today, my presentation is on violence at home. So let's start. As abuse involving the children, elderly person, and also the battered women is a universal problem that varies only in quantity for any given society. Many victims of physical or as well as the emotional abuse or neglect do not even recognize by the victims itself. Often, a medical person in the emergency department who is the first to identify the victim as a victim of violence. So, the violences at home comprises certain facts such as battered wife, battered elderly, battered baby syndrome also known as cafe syndrome, shaken baby syndrome, Munchausen syndrome by proxy, cot death or sudden infant death syndrome, child abuse and battered servant. Domestic violence is a huge problem in our population, and the synonyms of the domestic violence are partner violence, relationship violence, intimate partner abuse, spouse abuse, domestic abuse as well as wife abuse or wife beating or even battered wife. Use of coercion force against the wife is still right in all cultures or even society, acceptable in all cultures. As defined, battered wife is a woman who has suffered demonstrable and repeated physical injuries by a man with whom she lives or the father of her children. This involves the men below the age of 40 who suffers from personality or even neurotic disorder, while those over 40 suffers from psychiatric disorder. Prof has been categorized these men into 5 categories who are dependent passive, dependent suspicious, violent and bullying, dominating and normal, stable and affectionate. Domestic discord in families with many children and drunkenness are mostly responsible factors. It is neither commonly realized nor encountered in the society. The wives battered cannot be diminished accordingly. Generally, the women accepted the ill treatment at the hand of the man they live with as they are reluctant to disclose it for fear of shame or disgrace. But some prefer just to leave home, whilst others indulge the self-hurt, poisoning or even committing suicide by hanging, burning, drowning or even by self-poisoning. The offense comes to light when the victim requires treatment or dies under the suspicious circumstances. In Bangladesh, battering and torture are common in certain communities where custom of bride to bury and bring dowry amount being considered inadequate. The government has enacted special legislation to counter this problem. The common findings from these suspects are multiple bruises on exposed parts of the face or arm. Many may involve in the genitalia, the private parts, as especially by husband suspicious of wife's infidelity. Sometimes the tip of nose is cut off. The concept of family that are jointly living is terming the battered elderly. It has almost disappeared nowadays, the concept of joint families now resulting in decreased respect for the elderly. They are considered as source of burden or a hindrance to the independence and privacy of young generation. They are therefore neglected, often insulted and sometimes battered as well. In due course, the presence of elderly becomes intolerable and there are instances where financial incentives such as inheritance of property, insurance claim etc. has hastened their death. However, these are usually classified as natural or accounts on their old age. It would appear that the old age homes is now becoming a safer place for them rather than their family. The most vital trauma that may result from this abuse are bruising, subdural hematoma, fracture neck of the femur, also detectable during life, occasionally incidental finding of such subdural hematoma at autopsy. Now comes battered baby syndrome. The synonym of BBS, that is battered baby syndrome, are battered child syndrome, non-accidental injury of childhood, child abuse syndrome, cafe syndrome and also maltreatment syndrome in children. The battered baby syndrome is defined as a clinical condition in young children, usually under 3 years of age, have received non-accidental violence or injury on one or more occasions at the hand of an adult who is his or her parent, guardian or foster parent. In addition to this physical injury, there may be deprivation of nutrition, care and affection also in circumstances that indicate that such deprivation is not accidental. Classical feature that featuring this condition is the age, usually less than 3 years, though it may be at any age. Sex, that is slightly more in male, that is 55 to 63%. Position in the female is commonly also even the oldest, youngest or unwanted. Socioeconomic factors including the poor and criminal background, history of repeated occurrence of this feature, treatment history that requiring the previous treatment, precipitating factor as by the action of the child itself, crying, refusal to take food, quiet, perseverance, persistent swelling of the neck, etc. There are 6 patterns of child abuse that are recognized, that are physical abuse, nutritional deprivation, sexual abuse, intentional drugging, neglect or medical care or safety, and emotional abuse. The characteristic injuries often are seen as multiple injuries, not necessarily severe, but usually often the pattern with one or more localized bruises of the head, quite inconsistent with simple fall. Bruises on face, trunk or extremities consistent with the mark of the grip, tear in the frenulum of upper lip or alveolar margin of the gum. The stifle cries are common. The major injuries which prove to be fatal are fractured skull, subdural hematoma, visceral injuries involving the ruptured liver, normointestinal hemorrhage. Both clinically and radiologically it should be proven that the injuries have occurred at different times. Battered baby syndrome can be diagnosed when the injuries are identified in different degree and types at variance with his history. When injuries on different stages are healing are seen, when purposeful delay of seeking medical attention despite of serious injury. Those who exhibit fracture of bones, subdural hematoma or hemorrhage, failure to thrive, soft tissue swelling as well as a bruise on the skin, and who suddenly dies. Certain terms are also involved in battered baby syndrome, like as whiplash syndrome, that is infantile whiplash syndrome, known as shaken baby syndrome or abusive head trauma or shaken impact syndrome or inflict. The head injury of whiplash shake syndrome is a serious brain injury resulting from forcefully shaking an infant or toddler. It is a form of child abuse that may be either fatal or leave permanent neurological sequelae. Severe shaking of an infant who has virtually no neck muscle tone may cause bilateral subdural hematomas. Due to laceration of the veins, the bridging veins that are dura mater and cervical cortex caused by rapid acceleration and deceleration at the chin strikes the chest and occipital cord strikes the back. Subarachnoid and retinal hemorrhage are common, cerebral edema and cortical contusions without sign of external cranial trauma. Other terms such as Munchausen syndrome is finging illness or injury going from hospital to hospital for unnecessary investigations and treatment. These patients appear to be compulsively driven to make their complaints. The person is aware that he is acting as an ill, but he cannot stop to act. There is continuity ranging from exaggerated claims or infirmity to actual self-induced illness. The Munchausen syndrome by proxy is the term describing the action of one's person, usually the mother, who inflicts harm against another person, usually an infant or small child, in an attempt to gain sympathy and attention for both her own and her child's suffering. That's all for today. Thank you. Assalamu alaikum.